couple who were my patients many years ago. And it does present some ethical issues. And Bill will also do a reading, and he will give us a little bit of an outline of what some of these ethical issues are, and then we would have he and I will have a bit of a panel discussion, and we'll encourage you all to ask some free-ranging kinds of questions. Helga and Fritz Steiner found their way to me when they were in their late 70s. Fritz had been in the real estate business and was now comfortably retired in San Antonio. The Steiners had a daughter, Minna, who had long since moved away to California. She rarely visited her parents. She's busy with her law practice and her children, Helga explained. Fritz and Helga had many of the usual problems of the old. Fritz was 50 pounds overweight with high blood pressure and high cholesterol. Helga had arthritis. They always came in together for their appointments. We three sat in the exam room talking, exchanging jokes. Fritz was a great storyteller before we got down to the business at hand. He always answered for his wife, seemed in control of every situation. I could see why he had been so successful in business. Helga was a shy, quiet woman. She spoke with a German accent and smiled whenever I managed to dredge up a word or two for my high school classes. Wie geht es Ihnen, I would say, or Guten Tag. One day, Helga came in with a painful rash. The right pustules covered the left side of her face and extended down her neck and upper back. I recognized this as a classic case of shingles, a reactivation of the chickenpox virus that had lain dormant in her nerve ganglia ever since she contracted the illness as a young girl. At the time Helga came to me, antiviral therapies were not yet available, nor was the shingles vaccine. Treatment was limited to a short course of cortisone and medications to relieve pain. Within a few weeks, Helga's rash had cleared up nicely, but she continued to experience intense pain. This syndrome of continued pain in the region where the chickenpox rash had initially erupted is called, as you all know, of course, post-herpetic neuralgia. And usually with time and the use of pain-blocking medications, the sensation gradually dissipates, but Helga's searing pain was unremitting. She had the worst post-herpetic neuralgia I had ever seen. And I tried everything. I put her in the hospital for a thorough medical evaluation to make sure she didn't have an underlying disease or malignancy, conditions that can affect the body's immune system. My neurology consultants and I looked at her brain and neck and spine and sinuses, searching for evidence of a pinched nerve, a slipped disc, a tumor lurking somewhere, pressing on some vital structure. We found nothing. I put Helga on pain medications and muscle relaxants, sleeping pills, finally resorting to narcotic analgesics. Only when she managed to drift off to sleep was she pain-free. The chronic pain and the drugs killed Helga's appetite. She lost 20 pounds. Of course she was depressed. Who wouldn't be? And I sent her to a psychiatrist who prescribed even more medications. Eventually, I agreed to a last-ditch attempt at relief and allowed the neurosurgeon to cut a number of nerve fibers in Helga's neck. This failed as well. As they became unable to travel or entertain or even leave their home, except for doctor's appointments, Fritz and Helga's world collapsed. During our visits, Fritz often turned to me and said, "Do me a favor, doctor, give our daughter Minna a call. Let her know how bad off Helga is." I spoke to Minna on the phone many times at his request. I began visiting the Steiners at home every couple of weeks. They lived far from the medical center, but whenever I knew I was going to be in that area of town, I stopped by. The house was dark, the shades and curtains always drawn. Figurines, silver pieces, knickknacks covered every flat, undusted surface. Helga perked up when I visited. She'd get out of bed and come into the living room. Fritz told the old stories. We laughed together, drink tea, and eat ginger cookies. "Fritz," I said to him as he showed me out, "Helga does better with people around. I'm going to call a home health agency, have nurses and therapists and social workers come by. Maybe there's an adult daycare center nearby. You both need to get out of this house." "Don't you dare call anyone," he said. "I don't want anybody coming in from going through here. There's a lot of valuable stuff around here." "Fritz, You and Helga need some help, you especially. You can't go on like this. If you want to do something, call my daughter.